Hello everyone, this is an exercise for how to practice a fake end-to-end anastomosis, and I say fake because this is not how you would do it in real life, but it is a very nice exercise to practice general skills for when you're in the operating room instead of practicing inside patients. So muscle memory is something that you can build independently of your exposure to the operating room, and it's something that's actually going to improve the learning curve for the real skill that you want to build in real life. So this is the second update for my video series. The last one, which was uploaded last year in my channel around, I believe, April, was actually filmed in September 2023, but it took me some while to upload it for unrelated reasons. So the principles remain the same as in my last video, so I'm not gonna go into great depth when trying to explain them, but do try to notice not just the technique but also the hand motions and the tricks that I use to manipulate the needle and the instruments, because this is actually, it's not entirely different from real tissue. Of course, it's a plastic material. This is a Penrose drain, but practicing your skills in this manner actually teaches you principles like how to manage really long suture lines, as you just saw, how to play around with your instruments in a way that's not very different to what you will face in the operating room. So it's not that much about me teaching you an exercise, teaching you a skill, as much as it is about me teaching you a way to practice. And of course, you can embellish, you can practice on your own, you can enrich those exercises depending on the specific area of interest that you have, and make it more pertinent to what you will end up doing when you become an attending surgeon. So this practice regimen that I'm showing you, I do it very consistently. It's 3 times a week, 3 anastomoses. You'll see that this whole exercise takes me about, I want to say, 15 minutes if I'm in a real rush, or if I'm not in a rush, it might take me, I don't know, about 18 to 20 minutes per anastomosis. The practice regimen that I propose you guys try to do either at home or at work is about an hour and a half daily. Every other day, that is 3 times a week in total, and will actually improve your skills in the operating room, I think, very noticeably, because you'll find that it's not really that different manipulating tissue and manipulating things that are not tissue. Having said that, tissue experience is irreplaceable, and you should try to get as much exposure to the real deal as you can. So I might just go through some changes compared to last year's video, and of course I am a learner, so as I film those, if you want, yearly updates, I do tweak my technique quite a bit. So if you notice, compared to last year, I've transitioned to completely palming my instrument, which does provide a lot more freedom of movement, and of course adjustability when it comes to re-grabbing the needle and repositioning yourself. One thing that I also really like doing, and I did it last year quite a bit, and I found works in real life too, is using my forceps as a fulcrum. Whenever the suture is too long, I like to use my left instrument as a fulcrum to pull through the line. Now, again, this will take about 15 minutes, and so I will discuss pertinent points regarding technique as we go. Again, this is not how real surgeons do it in the operating room, end-to-end anastomosis, but it is a modification that works without you requiring an assistant, and that you can replicate either at home or during some downtime at work. And on the inside, you might notice that there are many uneven loops. That's because this is a braided suture. So pulling it through silicone, which is the Penrose drain. Actually, it might be lying there. I don't know if it's entirely silicone or some other material. But point being, there is quite a bit of friction between the braided suture line and the material of the Penrose drain, and using a very long suture line to film the video does not necessarily help my purpose of showing something very clear and precise. Again, establishing practice techniques early on in your learning journey will allow you to evolve them as you go. For example, you see I'm wrapping the string around my fingers, making sure it's not caught anywhere, and that allows me to bring it where I want it to be. This is actually something that you can do, that you often do, or need to do rather, in the real operating room as well. And you know, because I am a resident, I get to see which ones of those technique tricks work and which ones don't in real life. And so if I ever end up having medical students join me for my every other day practice sessions, I like to tell them, hey, there's this trick which I'm not sure in all honesty if it works or not, but you can try it for yourself next time you find yourself in the operating room during one of your rotations in med school, and see if it works for yourself. And you know, you might find someone whose technique you really like. Doesn't matter if they're an attending or a resident, senior or junior. You always have the opportunity to steal things from them and make up your own technique. And this is the beautiful aspect of the general surgery education. Seeing how different people from different specialty do things, and eventually incorporating things that you like into your own style, into your own specialty. And this is, if you like, how innovation in surgery is born. And it's not just me saying that. This is the surgical community as a whole. I just wish, I guess, that and it's gonna change with time, but I just wish that people valued I guess practical skill training outside the operating room, because this is not really a simulation. This is more a gym session, because simulation also has the element of face value to the exercises that you try to imitate things that happen in the operating room. You try to imitate tissue. But what I'm, I guess, trying to tell the medical students is that simulation is nice, but it can never replace reality, and it should not strive to. What simulation should be trying to do is not to simulate the real deal, but rather to find practical ways, reproducible ways, if you like, to practice those skills and to build muscle memory for the real deal. And I'm sure that the best surgeons in the world are the ones who end up operating the most, so they get to have the largest volume of patients. And if they end up doing a procedure hundreds or thousands of times, they become really good at it through repetition. But I can't help but wonder, what if we replace a part of the part of our training that focuses on muscle memory? What if we replace it completely with things that we can do on our own, by taking the simulation aspect out of the picture and keeping the training aspect or the warm-up aspect, similar to how a musician practices their scales, or how a car mechanic is working on cars in their garage. Surgeons cannot do that, unfortunately. Or fortunately, surgeons cannot open people up whenever they feel like it to practice their skills. And wet labs and pig labs can only go so far. They're expensive. No one's gonna go to the butcher every day and get a fresh piece of meat to practice on. It's messy. It's just not for every day. But this could be for every day, what I'm showing you now. And this is just one aspect of the training regimen that I propose you guys do if you're general surgeons in training like me. And I guess you can see if it works out for yourselves. Like, if you become better, if you like the surgeon that you're becoming, you can keep practicing. If it doesn't work for you, by all means, just toss it away. Don't watch those videos again, because it's still quite experimental. And my opinion doesn't matter if I say that, all this makes you better, but I'm a junior trainee myself. But I have a strong conviction that people who practice regularly end up being better surgeons than the ones who don't, or who only practice, quote unquote, inside patients. I think compared to last year, my exercise is a lot more cleaner technique wise. Like, I don't waste as many motions as I used to. It's primarily because I've repeated the same exercise many times, but also I think because we're finding ways to do things more efficiently. And you'll see the finished product in a second there. So if you look at this all the way around, you see how messy it looked on the inside. On the outside, it's actually quite neat. Now the next step, so that I don't waste too much suture, what I like to do is I like to purse string this whole this whole suture around gradually so as not to tear my suture, and this way I preserve as much suture as I can. I think it's 15 minutes now, so I'm pretty consistent with what I promised. This exercise can take 15 minutes if you're used to doing it. You can modify it. You can do many things. You've seen me use my left arm hand, you've seen me use my right hand, forehand, backhand, you name it. It's all about getting the practice hours in. And you know, if you think you see it in yourself that you're becoming better with time, then by all means keep practicing. But if you don't think it's helping you, just, you know, forget about it. I just wanted this video to be on file to record my yearly progress, and just throw a few knots there. You can always practice your instrument tying as well, which is infamously difficult to practice without wasting tons of suture. Of course, if it's a braided suture, so throwing 4 knots would be sufficient, but you know, again, there is an aspect of practice to this whole exercise. Okay, so that's it. Let me show you the inside as well. There you go, nice and patent. And if you actually blow, put your mouth here and blow, you'll see that it's also holding pretty well. But I'm not going to do it right now. So you can do this, I'm going to show you tens or hundreds of times, and you'll end up with those nice string of finished anastomoses. I have many of those. 3 times a week I like to practice with a medium, a long, and a short needle driver. So 3 anastomoses every session, 3 times a week, so 9 anastomoses per week. If you get used to the exercise, that can take you like 45 minutes. It's like going to the gym, and you can combine it with knot practice and laparoscopic, robotic, and even endoscopic training if your institution has the means to provide you with nice devices to practice. That's it for me. Thank you for watching, and I guess I'll see you next year.